Hey doctors, I haven't been getting to the gym the last few months because the pandemic closed gyms, and I've noticed since I have gotten back to my normal routine, my back knee is really flared up. I was wondering if I get the opportunity to see a dermatologist, is there anything I can be doing in the meantime to give me a little bit of relief and to clear it up?
We all know acne can be an extremely embarrassing problem, but if you've got back knee, it can even be more annoying. And here to shed light on our back knee is our good friend, dermatologist Dr. Sonia Batra. Welcome, Dr. B. How are you?
Hi, Dr. Batra.
So good. Thank you so much for having me, Drew. Nice to see you.
So a pretty common issue, I would think. Do you see a lot of back knee in your practice?
Yes, so I've always seen a lot of back knee, but I would say during the pandemic, it's been even more because with gym closures, people are walking, people are hiking. And so with that form of exercise, you get this buildup of sweat, and then that leads to acne on the back and all over on the body. Especially when people wear clothes that don't breathe, it becomes a film that just sits there and forms a pore clogging film.
How is back acne different than face acne?
Back acne and facial acne are both driven by hormones, but with back acne, we see a lot more due to exercise, due to sweat, and due to occlusion. And so the pattern tends to be different. When you see it on the face, it usually starts with clogged pores, versus on the back, when people come in, it's often these red, painful, under the surface types of spots. And remember, the skin on the face is much thinner, it's much more sensitive, so you have to be much more gentle when you address products to the face as compared to the back.
What are the options when it comes to treatment of back knee?
Well, I think my first tip is really simple. It's just to shower off as soon as possible after a workout, because like I mentioned, you really don't want that sweat to dry on the skin. And over the counter, there's some great ingredients to look for in body washes like benzoyl peroxide or salicylic acid. And what they do is they really clean out and penetrate the follicle, and they kill some of the bacteria. But when those tips aren't enough, you may need a prescription strength option. And so some of my favorites and go-tos when it comes to back knee are sulfacetamide wash, which is a prescription strength anti-inflammatory and antibacterial. And then some people with more inflammatory acne may even consider oral antibiotics like doxycycline or minocycline.
So you're saying people usually need prescriptions for those medications?
I wouldn't say usually. I think the simpler steps are always the better way to start. So like I mentioned, just the simple intervention of making sure the sweat doesn't dry on your skin, try an over-the-counter wash first. But then keep in mind, if it's really inflammatory and it's causing scarring or discoloration, then before you allow that to accrue, because sometimes it can be really difficult to get rid of the marks and the footprints that acne leaves, then absolutely you should consider a prescription regimen.
Josh wants to stay at home due to COVID, but still needs a prescription. So he's in luck. Josh and everyone at home can get these medications shipped straight to your door. Obviously, you need to be examined. So first, you visit geteczema.com online from any device. You're then asked to fill out a form as if you were going to the doctor's office with some basic questions about your general health and your condition. And at that point, a board-certified physician will review your answers and see what your diagnosis is, and if you're a good candidate for medication. If in fact you are, Eczema will discreetly ship your prescription right to your home. And most of the time, you don't even need a telemedicine appointment.
And Dr. Orden, we're not just talking about acne medicine. You can also get meds for hair loss and erectile dysfunction. I love that the whole process is quick, it's simple, private, and it's safe.
Well, yeah, and these are all potentially embarrassing private issues that you'd rather not discuss with the doctor. So this is a great option. And Dr. Batra, as always, thank you so much for your great information and for joining us today. For more information about eczema wellness, go to the website geteczema.com or go to our website, thedoctorstv.com.